Welcome to our medical quiz channel that deals with physical and mental health information.
This quiz is for educational and entertainment purposes only. It is not medical advice, diagnosis, or treatment. If you have health or mental health concerns, please speak with a qualified healthcare professional. Welcome to Quiz-Quizzabay. Test your knowledge about Lyme disease, tick bites, symptoms, diagnosis, treatment, prevention and the question of whether Lyme disease is autoimmune with this 15-question medical quiz. This quiz is educational and is not medical advice. Question 1. What is Lyme disease? Option A. A lifelong autoimmune disease that starts without infection. Option B. A skin allergy caused by any outdoor insect bite. Option C. A bacterial infection spread through infected black-legged tick bites. Option D. A joint disease caused only by cold weather. Choose the right answer. Correct answer. Option C. A bacterial infection spread through infected black-legged tick bites. CDC and Mayo Clinic describe Lyme disease as an infection caused by Borrelia bacteria spread by infected ticks. Question 2. According to CDC estimates, about how many people may be diagnosed and treated for Lyme disease each year in the United States? Option A. About 476,000 people. Option B. About 47,600 people. Option C. About 4.7 million people. Option D. About 4,760 people. Choose the right answer. Correct answer. Option A. About 476,000 people. CDC says estimates suggest about 476,000 people may be diagnosed and treated for Lyme disease each year in the United States. Question 3. Is Lyme disease an autoimmune disease? Option A. Yes, it is mainly an autoimmune disease from the beginning. Option B. Yes, antibiotics are never useful because it is autoimmune. Option C. No, it is only a simple rash and never affects the immune system. Option D. No, it starts as a bacterial infection, with later immune responses under study. Choose the right answer. Correct answer. Option D. No, it starts as a bacterial infection, with later immune responses under study. Mayo Clinic and CDC identify Lyme as bacterial. Tufts research discusses possible autoimmune responses in some persistent cases. Question 4. How do people usually get Lyme disease? Option A. By touching a person who has a Lyme disease rash. Option B. Through the bite of an infected black-legged tick. Option C. By breathing air in wooded areas. Option D. By eating food touched by ticks. Choose the right answer. Correct answer. Option B. Through the bite of an infected black-legged tick. CDC says Lyme disease bacteria spread to people through bites from infected black-legged ticks. Question 5. Which early symptom pattern best fits Lyme disease? Option A. Chest burning only after a heavy meal. Option B. A rash that always itches severely within minutes. Option C. Fever, headache, extreme tiredness, muscle aches or a spreading rash. Option D. Joint pain only after years with no earlier signs. Choose the right answer. Correct answer. Option C. fever, headache, extreme tiredness, muscle aches or a spreading rash. Mayo Clinic lists fever, headache, extreme tiredness, muscle aches, joint stiffness and rash as early symptoms. Question 6. What is true about the Lyme disease rash? Option A. It may slowly spread and sometimes look like a target or bullseye. Option B. It always appears on every person with Lyme disease. Option C. It is usually a tiny rash that disappears within 1 hour. Option D. It is always painful and intensely itchy. Choose the right answer. Correct answer. Option A. It may slowly spread and sometimes look like a target or bullseye. Mayo Clinic says the rash can slowly expand and may look like a target, but it does not always happen. Question 7. If Lyme disease is not treated, where can the infection spread? Option A. Only to the skin around a tick bite. Option B. Only to the stomach and intestines. Option C. Only to the throat and sinuses. Option D. To joints, the heart and the nervous system. Choose the right answer. Correct answer. Option D. To joints, the heart and the nervous system. CDC says untreated infection can spread to joints, the heart and the nervous system. Question 8. How is Lyme disease diagnosed? Option A. Only by checking whether a tick is still attached. Option B. By symptoms, possible tick exposure, physical findings, and sometimes blood tests. Option C. Only by a routine urine test. Option D. Only by measuring vitamin levels. Choose the right answer. Correct answer. Option B. By symptoms, possible tick exposure, physical findings, and sometimes blood tests. Mayo Clinic says diagnosis depends on symptoms, possible tick exposure and blood tests for antibodies. Question 9. What does CDC recommend for laboratory diagnosis of Lyme disease? Option A. FDA-cleared antibody tests used correctly. Option B. Home allergy tests for outdoor plants. Option C. A single photograph of any skin rash. Option D. Testing the family pet instead of the person. Choose the right answer. Correct answer. Option A. FDA-cleared antibody tests used correctly. CDC recommends FDA-cleared antibody tests for laboratory diagnosis when testing is needed. Question 10. What is the standard treatment for most Lyme disease cases? Option A. Only rest, because antibiotics do not treat Lyme disease. Option B. Long-term steroid medicine as the first choice. Option C. Antibiotic medicine, often taken by mouth for 10 to 14 days. Option D. A special diet that kills the bacteria. Choose the right answer. Correct answer. Option C. Antibiotic medicine, often taken by mouth for 10 to 14 days. Mayo Clinic says antibiotics treat Lyme disease, and pill treatment usually lasts 10 to 14 days. Question 11. When may preventive antibiotics after a tick bite be considered? Option A. After any insect bite, even without tick exposure. Option B. Only when a rash is already severe for months. Option C. Whenever a tick is seen outdoors but has not bitten. Option D. When the tick is a deer tick, exposure is in a Lyme area and attachment was 36 hours or more. Choose the right answer. Correct answer. Option D. When the tick is a deer tick, exposure is in a Lyme area and attachment was 36 hours or more. Mayo Clinic lists those conditions for preventive antibiotic use after a high-risk tick bite. Question 12. What is the recommended way to remove an attached tick? Option A. Cover it with petroleum jelly and wait for it to fall off. Option B. Use fine-tipped tweezers to grasp near the mouth and pull steadily. Option C. Crush it with bare fingers while it is still attached. Option D. Touch it with a hot match to make it release. Choose the right answer. Correct answer. Option B. Use fine-tipped tweezers to grasp near the mouth and pull steadily. Mayo Clinic recommends fine-tipped tweezers and warns against petroleum jelly, nail polish, alcohol or a hot match. Question 13. Which habit can lower the risk of Lyme disease? Option A. Use tick protection such as repellents, treated clothing, and avoiding tall grass. Option B. Avoid all exercise during spring and summer. Option C. Take antibiotics before every outdoor walk. Option D. Check only the hands because ticks never attach elsewhere. Choose the right answer. Correct answer. Option A. Use tick protection such as repellents, treated clothing, and avoiding tall grass. Mayo Clinic and CDC emphasize preventing tick bites with repellents, protective steps, and avoiding tick habitats. Question 14. What does Mayo Clinic say about long-lasting symptoms after Lyme disease treatment? Option A. They always prove that live bacteria are still present. Option B. They mean antibiotics should always continue for years. Option C. They may have several causes, including reinfection or immune system activity. Option D. They are never related to earlier Lyme disease. Choose the right answer. Correct answer. Option C. They may have several causes, including reinfection or immune system activity. Mayo Clinic says persistent problems can have several causes and continued antibiotics have not shown benefit for these symptoms. Question 15. What Lyme disease research question is Tufts studying? Option A. Whether mosquito bites are the main cause of Lyme disease. Option B. Whether phospholipid autoantibodies may help explain some persistent symptoms. Option C. Whether Lyme disease spreads through casual contact. Option D. Whether ticks can be removed by avoiding water. Choose the right answer. Correct answer. Option B. Whether phospholipid autoantibodies may help explain some persistent symptoms. Tufts researchers are studying autoantibodies and whether immune responses may play a role in persistent Lyme symptoms. Check your score. 0 to 5, keep learning and try another quiz. 6 to 10, good effort. 11 to 15, excellent score. The trusted medical sources used for this quiz are listed at the end of the video description. You can visit those links to learn more from the original authority sources.
Thanks for watching. Please like and subscribe. Remember, this is not medical or psychiatric advice.